You are in the ring with Hector Colon, 7-time national boxing champion turned nonprofit president and CEO. Hector knocks out the big issues facing social services today with high-impact leaders from around the U.S. In the Ring is a creation of Lutheran Social Services of Wisconsin and Upper Michigan and is produced by No Studios. And now, here's Hector Colon.
Hello, and welcome to In the Ring with Hector Colon, the show that gets real about the challenges facing the social services sector and the people we serve. I am so grateful to the wisdom I gained from my Season 1 interviews with thought leaders from across the country, addressing the challenges that face our colleagues, the people we serve, and how they are ensuring the financial viability of our sector. You can check out all of my interviews at LSS.WIS/in-the-ring. I hope the conversations spark awareness and that they serve as inspiration to all of those connected in our sector. This year, we're going to dig into the punching power of our sector, highlighting the many ways that thought leaders and organizations are knocking out their challenges and moving their organizations forward. Subscribe on YouTube and follow us on Twitter and LinkedIn so you don't miss any of these important conversations in the future. Thank you to In the Ring podcast sponsor M3. We are so appreciative of your sponsorship, your partnership and friendship, and all you do for LSS and so many organizations across the country. Okay, as my coach Shorty used to say, let's go, champ. In the ring with me today is Michael Lappin, the administrator of Milwaukee County Behavioral Health Division. Welcome, Michael.
Thank you for having me.
Thank you. So Mike became the administrator of Milwaukee County Mental Health Services in 2016. And I recall the newspaper article that went out. Bill Gluber said Mike Lappin is about to take one of the toughest jobs in local government. And I agree. This job was a really hard job back then. It continues to be a hard job, and Mike Lappin has done a great job. Mike Lappin became the division's administrator, the sixth administrator in just 10 years. So it was high turnover in that role. And he came from where he was the director of Ozaukee County Health and Human Services, where he oversaw a staff of 100 and a $12 million budget. I was serving as the Director of Health and Human Services at the time, where we were moving away from an institutional model of care towards a community-based model of care. And we invested millions of dollars. We closed our long-term care institution and invested millions into the community to move in that direction. But we needed to do a lot more. We were in the beginning stages of that major turnaround. A lot was accomplished, but more needed to be done. In that article that I was referenced, I said, Mike Lappin was the right person for the job because he has great leadership. He is very data-driven and is collaborative. I also shared that we are redesigning our system. We made lots of progress, but Mike was the right leader to take us home. Mike and I also started our careers together. Mike hired me when I worked at Wisconsin Correctional Services as a clinical providing mental health services for individuals that came out of long-term care units. So I learned a lot from Mike then. We grew up together, and it was an honor and privilege to work with you for a short time while I remained at Milwaukee County before I left to the organization I love now, Lutheran Social Services of Wisconsin and Upper Michigan. Welcome, Mike.
Again, thanks so much for having me. And it's fun to reminisce, to hear it all, sort of hear you talk about it. It's always fun to reminisce about where we are and where we get to go from here. So.
Great. Thank you so much. Okay. Are you ready for round one?
I am.
Good. So I remember, I think it might have been 2010, where the HSI report came out and had many recommendations for us to move more to a community-based model of care. And Chris Abley hired me. We started making some bold changes and putting some stakes in the ground and trying to move that more towards community-based model of care. We closed the long-term care institution, which was really hard. But again, a lot needed to be done to be where we're at today. And Mike, you've done an extraordinary job to get us there. But why don't you give the audience a little perspective of the history of mental health in Milwaukee County, what it was and what it looks like today?
So to do this justice, it's a long story because it's a long history, but as briefly as I can do this, it really goes back to the 1850s, right after Wisconsin becomes a state. The Milwaukee County Board of Supervisors at the time elected to take responsibility for all of the poor folks that lived in Milwaukee County. So they essentially put out an RFP. They didn't call them RFPs then, but they sought to purchase a farm to become the county poor farm. So lo and behold, they offered $5,000. A county supervisor at the time stepped forward and said, I will sell you my farm for $6,000. And the extra money is that I'll throw in the barn and all my cows. So the county gets into the business of operating the poor farm in about 1851. Before that, folks lived in poor houses and sort of really just wherever the town would take care of people. So they had this centralized poor farm. Quickly, it became obvious that people who were poor needed medical attention. So they created a field hospital. In the first year that hospital operated, they served 34 people, and 16 of them were identified as so-called insane persons. So right there is the first time in the history that you see that people with mental illness are referenced. Fast forward, there's an act of the legislature a few years later that says Milwaukee shall establish an asylum. That asylum, it was very progressive at the time. The legislature basically said the only two places to go are the state hospital at Mendota, the state hospital at Winnebago. Those would have been multi-day horse rides from Milwaukee, so it wasn't nearby. It did not serve our community. So the idea, again, which sounds really progressive even today, was to create an asylum in Milwaukee to serve people closer to home. The hospital opened on March 26, 1880. Was the asylum for the acute insane in Milwaukee. The buildings are long gone, but that was the first hospital. Within 9 years, they built a second facility. And it really began this era of institutional care that really carried through all the way until 2010. And so, again, I skipped a lot of history, but really what happened is as treatments evolved, as community-based programs were proven, the program we had was that we worked together in basically served 50 people who lived on two adjacent long-term care units in Milwaukee County, 44A and 44B. So the people that we served together had lived into the hospital for many, many years, some of them almost their whole adult life. And we proved that if you provided adequate community-based services, they didn't need to be in the hospital. That really reduced the need for the last hospital we operated, which closed on September 30th officially. It was built for 1,300 beds. By the time I got onto the scene, it had 54 total beds in a 1 million square foot facility. And so it was really obvious that we needed to exit the hospital business. The HSRI report that you referenced from 2010 also said we should get out of the hospital business. And so we really wanted to focus on those community-based interventions instead.
Yeah, it's pretty interesting, the old terminology that was used, and all went well intended in the beginning. There were beautiful facilities, but it ended up being an old model and needed updating and needed to move towards this more community-based model of care that really provides people with better outcomes, with more dignity, and just really is the right thing to do. So thank you for sharing that, and thank you for being part of an extraordinary effort and an effort that I believe is really a national model right now, where we were so delayed in our progress, but now we've evolved, and you've evolved to develop a great model that the nation can look upon and look to as an example of how to administer mental health services in their community. And so thank you for that. Maybe talk a little bit about some of the redesign efforts specifically that under your leadership that happened, and how you've closed the hospitals, the partnerships you develop. And if I could just make a shout out to when I was there, and I know you'll share this as well, the enormous partnerships that we've had from our colleagues at the Behavioral Health Division, the advocates and the policymakers and community-based organizations, and just so many people came to the table. Some of them were in opposition too, so there was always that conflict. But at the end of the day, we had more people that were willing to fight to do the right thing. Share a little bit about that and some of the redesign under your leadership.
Absolutely. So love to talk about this stuff. Again, I am not wearing the Mission Accomplished t-shirt yet because our work is really never done. But, since 2010, we've made great strides. You mentioned the HSRI study. The original 10 recommendations, and I could name them, but I won't, basically said, do more community intervention, help people sooner, add peers, people with lived experience to your treatment teams, really embrace this idea that people can recover and that they're better served by people who are more culturally competent, who are right there with them. And so in 2018, we had gotten to the point where we had a partner to take over our hospital, but they weren't able to manage our emergency room. So we brought back HSRI for a follow-up. And they basically came and they said, you guys knocked it out of the park. You did great. Now, here's where you have to go from here. And so we partnered with the Wisconsin Policy Forum. I believe at the time that was under their old name, but Rob Henkin was a great partner. And they basically said, Milwaukee County really needs to maintain the emergency room as a center of excellence. So we had over time evolved. There's a unique statutory requirement in Milwaukee that basically says for a person who's being cared for against their will, so people who are in police custody due to a mental health crisis, the county must provide a psychiatrist's assessment within 24 hours. So we had always achieved that by having operating our own emergency room. So one of the major recommendations and the biggest opportunity for partnership became preserving that emergency room for the Milwaukee community. So we looked at all the data. Again, the Policy Forum was really instrumental in helping us formulate the discussion. We looked at a heat map. We saw that 93% of the people we served lived in the city of Milwaukee. 71% of the people we served historically over 20 years lived in 10 zip codes, 8 on the north side, 2 on the south side. And lo and behold, there was a small county-owned parcel in the center of the 53205 zip code, about a couple of blocks from where we're recording today, that was a perfect spot. And really, to make a long story short, we approached the health systems because we served about 8,000 people a year in 2018. Only about half of them actually were involuntary and in need of this court-ordered or statutorily required assessment. The other half came to us because they knew we would treat them with dignity and respect and that we would help them. And so our argument was, we're providing a service for the community, but only half of it is really required. So we said to the health system partners, we'll pay half if you basically help with the other half. And what ended up happening is a partnership evolved with the Behavioral Health Services and the Department of Health and Human Services and Ascension Children's, the Medical College, Aurora Advocate, and we created this new resource that we delivered together. And we'll talk a little more about how that partnership really is impacting treatment. But the idea was we saw a gap in the service. And really, to your earlier question, all of the community-based services that we provide, you really need that service for when someone's in crisis. Mm-hmm. And without that, the whole thing could have fallen apart. And so we wanted to preserve this intervention.
Mike, that is wonderful. It really is something to your credit on how you were able to pull these partners together to make this happen. And I know that wasn't easy. And it turned out, again, I believe, to be really a national model, what you were able to accomplish. The community should be very proud. And we should be very thankful to the health systems also for really stepping it up. One last question, and we're going to go into round two.
Okay.
So who are you serving today? And, what are their biggest challenges?
So traditionally, the county has a statutory responsibility. We manage this involuntary system, but truly under the leadership of our county executive, David Crowley, our Health and Human Services Executive Director, Shakita LeGrant McLean, we have really moved into a world where we're trying to serve people upstream and more proactively. So what we've done is we've expanded, and this aligned with the recommendations from 2010 and again in 2018. We've expanded our crisis mobile services, so we're out there. We want to help anyone who needs us at any time. So we operate a crisis line 24/7, 365. We can do mobiles. We do all sorts of collaborations. And then we've embedded in our outpatient mental health services in a number of community health centers. And we deliver services in partnership with those community health centers so folks can walk in. Ideally, they come to us before they need to call 911 or before they're in crisis, and then we can help them sooner. And then we have this very large network of community-based services where we really try to do a person-centered approach to match a person's needs with the services that best help them achieve their goals.
Great. Thank you. Thank you. Well, that completes round one. In round two, we're going to discuss issues around chronic homelessness and how it impacts people with lived experience. But first, a word from our sponsor.
Supporting your employees is more than a paycheck and 401k. It's just a fact. People today are at a higher risk of experiencing mental illness, housing insecurity, and substance abuse. Do you know the health of your employees, your communities? How can you step up your benefits to better address their well-being? M3 Insurance helps businesses see beyond basic benefits and support employees where they live. It's a meet them where they are approach that LSS delivers to their clients every day. M3 and LSS offer real solutions to now commonplace realities that strengthen employees and inspire communities to thrive. Test your employee benefit strategy now by going to m3ins.com.
All right. Are you ready for round two? You got to say it.
Yeah, I'm ready.
Come on, champ. Are you ready for round two?
All right, I'm ready.
All right,
I'm ready.
good. So with my previous guests, we've been talking a lot about the social determinants of health, which includes housing, food, transportation, medical. The science and the research is very clear that when all of those needs are addressed, it improves the health and well-being of individuals and communities. And so with you, Mike, I'd like to focus on housing. Could you tell us a little bit about the collaboration that the Behavioral Health Division had with housing to end chronic homelessness? Again, I was so proud to be there during the beginning stages when working with Chris Abley, where we declared that we want to put a stake in the ground and say we're going to end chronic homelessness in Milwaukee County. And it was good to be a part of that, and you guys continued that. And so tell us a little bit more about that, where that's at, and the progress that you see as a result of that initiative.
So we've made amazing progress there. Again, the work is never done. There's still folks outside, but the effort around managing and serving those folks that were considered chronically homeless led to some very strong collaborations. The Milwaukee County Mental Health Board, which is my governing body, allocates $1 million a year to the housing division, recognizing that the housing division is essentially the outreach arm of the behavioral health division in this space. So many folks living outside have a mental health or substance use issue as well. So for people dealing with those issues who are also outside, we work very collaboratively to come up with solutions. So targeting chronically homeless folks was a big deal. Also embracing the housing first philosophy, where we basically provide housing, offer housing with no strings attached. So many folks, once they have a safe place to live, they're so much more willing to take part in treatment or see somebody or follow up and get the care they need. And so those things really led to the successes that we're experiencing today.
Yeah, I remember those outcomes were pretty extraordinary. So the housing first model, again, you're there to love them, to care for them, and to give them a house with those no strings attached. But the overwhelming majority of those individuals end up accepting care and wanting care. And that's why it has resulted into great outcomes for those individuals. Thank you again for your courage, your discipline, and making sure that you continue with that effort. I know it had great outcomes, not only for those individuals that are oftentimes forgotten about, but it was good for the taxpayer and for behavioral health.
Our study showed, our data showed the first couple of years, they kept really tight data. There's about a 90% reduction in the number of arrests and charges that people who were in the Housing First program experienced after they were admitted. So we took the 2 years before they were in Housing First and compared it to the year after they were placed in Housing First. There was like right around 90% reduction in the number of tickets and arrests. So it really had a substantial impact in keeping people experiencing mental health and substance use issues and homelessness out of jail.
Yeah. I want to give a special shout out to Jim Matthew, and maybe Jim Matthew will get him in the ring with me in the future. For all his great work. He's known nationally for this effort. And also County Executive Chris Abley, who was willing to put a stake in the ground. I remember we did a press conference. We invited the city and major leaders in this community and said, let's get this done. And I've heard that they've reached functional zero, meaning that there's enough housing to place individuals who are chronically homeless in this community. Can you tell a little bit more about that? I know you had some conversations with Jim Matthew on that.
Yeah, and so there have been times in the last year or so that we've been at functional zero. I think the challenge is there's some criteria before you can officially declare that. But the truth is, yes, the population of chronically homeless, which there's a very formal definition. It really refers to people who've been outside a year, who've been had a series of housing or interruptions over the year, or who have a disability. And so that is a priority target group. And it really was a partnership. So you mentioned this, but many partner agencies, there's all kinds of volunteers involved. There's a whole system of care around the shelters and really keeping people safe that collaborated under this banner. Everybody got on board and worked together to solve this challenge as a community.
Great. Why don't you tell me about the challenges with obtaining affordable housing for the people you serve? And are you knocking out those challenges, Sam? I want to hear it.
I wish I could say it was easier, but housing is our single greatest challenge. So many of the people we serve have a criminal history, or they've had some drug charges, or they've had some behaviors that have gotten them in trouble. And in a really tight housing market, they're not priorities. And so we run into, and then the stigma, there's just overriding community-wide stigma around people with mental health and substance use issues, all of those things. And just the cost of housing and the challenges around affordable housing have really impacted our group, who are often, as you mentioned earlier, these are the folks who are marginalized. They're often falling through the cracks. And again, it's the single greatest challenge for the folks we serve, is to find a safe place to live that they can afford.
1 in 4 of us has a mental health condition. And so they are your neighbors. And oftentimes you don't know about it because they're just like you, right? They're individuals that work, that are in your community, that want to be in a safe environment, just like everybody in our community. And so, that stigma is really unfortunate.
Yeah, we see the not in my backyard thing. I don't have to tell you. We had some challenges when you were DHHS director. We created some resources that remain effective today, and we've never had a problem. Knock on wood. But the neighbors, just the not in my backyard response was so overwhelming. It makes it really hard to create new things that serve people.
And tell me about one of the last ones where I were there, where there was an uproar in the community. People didn't want the facility, and we placed some of the individuals that needed more attention and more services. So it wasn't like we were just transitioning these individuals into the community. We were providing them with individualized treatment plans and the supports they needed to be successful. Tell us a little bit about that.
Well, the program has been very successful. None of the things the neighbors were scared of ever happened. And in fact, the entire cohort that was placed in that facility originally has now moved on to less restrictive settings, and new folks have moved in, right, which I would mark as a success, because when I came here and when we first discussed this, the idea was that this facility probably would serve these people for the rest of their lives. And in fact, we underestimated the power of resiliency, and these folks did really well. Similarly, on the Housing First side, there's about a 30% turnover of people in what we would call permanent supported housing. So people who get regular support in their housing, where about 30% of those folks move into much more independent housing every single year, freeing up space for the next group of folks who needs that assistance. So our whole system is built upon recovery and resiliency, and really getting people to their best selves and where they live independently.
That's awesome, Mike. I really appreciate you sharing that because that's important. You're trying to give these individuals the resources they need to be successful, but them helping them reach their full potential. And hopefully, in the future, they might not need the level of care they needed at day one. Sometimes they don't need care at all. Other times they might need, some type of care to remain in the community successfully and independently, but it could be less in the future than what it is today. So that's wonderful that you're working on that journey with these individuals. I appreciate you sharing that, and again, your leadership to really make that happen. That completes round 2. In round 3, we're going to dig into innovative partnerships that have been key to improving the county residents' health and well-being in Milwaukee County. We're also going to discuss the state budget and its considerations and how mental health is in there that could really help improve the health and well-being of some of our most vulnerable in our community. Are you ready for round 3?
I am ready.
Great. We're going to drill into strategic partnerships and innovation. Again, just to give a shout out to so many individuals that are involved in this major transformation. County Executive Chris Abley, who was willing to go bold and make some major decisions that moved us in the right direction. Dr. Schneider, all of your staff, just so many people that made this happen. But it's really hard. And, it doesn't go perfectly. And there's lots of challenge, because there's differing opinions. What are some lessons learned you could share with us? So as we're going through transformation in our own organizations and our own communities, what are some aha moments and things that you learned that could help our audience as we're going through change and transformation?
Well, the most important thing I've said that the most important thing that I've been part of in the last few years, probably the defining thing of my career in Milwaukee, will be the Mental Health Emergency Center. And in that scenario, we knew we had a good thing. We had a nationally recognized best practice, but it was really entirely on the county, and that wasn't sustainable. There had become this dynamic where there was sort of the county patient and then the health system patient, and we had to blow that up. We just had to. So we reached out. We found common ground with our partners. Again, the major hospital systems, so, Aurora Advocate, Children's, Freighter to the Medical College, Ascension. And we found that everybody had a reason to participate in this thing that greatly impacted the community. We just had to get past all those barriers you mentioned and bureaucracies and opinions to deliver a service that would serve the community. We achieved that. And it, while it's not perfect, but the fact that we have a center of excellence that today is fully staffed, that is in the heart of the Milwaukee community, very close to the people we serve, is an amazing outcome. And it is catalyzed additional relationships that really have thrown this idea of the county patient out the window. Our community, for the first time in 142 years, really looks at it like we are serving a community of vulnerable individuals who are in a mental health or substance use crisis, and we're going to solve that challenge together and look for those outcomes that make our community healthier.
I love that, Mike, because, yeah, you're right. These are county patients and these are other patients the way it was talked about in the past. So now that, they are people and they could be served by Aurora, by Children's, by Ascension and by us, by the county. But they are people and there are people that they have great potential and some of them have great needs, but you're there to serve their needs and help them reach their full potential. So thanks for sharing that. When you move towards a community-based system of care, I know when I was there, the county was pretty delayed in being able to provide our providers an adequate rate that was commensurate to the value they provide society. And we made substantial strides. We coming from, years and years and years of no rate increases. And so people were appreciative. We weren't quite able to get where we needed to go. But tell us a little bit about your journey on that, your rates and how you deal with your partners.
So it's a great point. Right now, it's really challenging to find great staff. Any industry, but is hard. Healthcare is extraordinarily hard. Unfortunately, mental health and substance use is even harder because of the scarcity of qualified folks. So we know we rely on partner agencies that you've said. Most of our services are delivered through partnerships. So the rates we pay have to support good people if we expect good people to provide this service. So we've targeted key services and provided those enhancements where we can. Unfortunately, the way stigma works is, even though we technically have parity in the United States, the rates paid for mental health and substance use services are nowhere near the rates for other medical challenges. And so we operate in an environment where we're already starting a little bit behind. We've been blessed. There's been some developments. There's a program called Comprehensive Community Services, which is fully funded by our state. Essentially, the county runs the program, but really our partners deliver the service, and we're able to provide a reasonable rate, and then the county is made whole. That has made a significant difference. Likewise, the state has moved into a place in the last few years where crisis services are fully funded. The county's maintenance of effort, or our sort of copay on those services, is fixed at 2017 level. So we can grow crisis as much as we want, fully reimbursed. We've invested all of those opportunities and the savings of not operating a 1 million square foot hospital with 50 patients into those community-based services to really bolster those services so they're there to serve the community.
That's great. Now I'm going to give you a little bit of a hard time, champ. I was going to respond. LSS was going to respond to one of your RFPs, and we took some time, and I even told my colleagues, I said, look, if we lose 100,000, 200,000, I still wanted to be in Milwaukee and be a major player, and then we'll fundraise for the difference. But they came back and said, Hector, there's about a $500,000 gap, and that was something we just couldn't do. And so I just wanted to share that with you to say that I know you're making a lot of progress, but those rates, if you could redirect more of those savings to the community-based providers, because I know others are facing a similar, and you're not. This isn't the case because you don't want to do it. I know there's limited resources that are available to do it, but you want to talk a little bit about that, champ?
Well, you're talking about the Community Support Program, or CSP, and it's true. We received a $4 million grant over 4 years to operate our own program at the county, which we wanted to do, but that was the gap then. So it was $1 million for us to deliver that same high level of service, and there was a item in the state budget that I have lobbied for about 10 years, where the state would have funded that program, CSP, like they do CCS, making the county whole. That would have allowed us to expand. Unfortunately, that was one of those 1 or 2 in the morning cuts from the budget document. We are hopeful that funding will be restored through separate legislation, but that particular program is so amazingly effective. And I could spend an entire podcast talking about ACT and assertive community treatment and how amazing it is to serve people. But my role, and as I've been fighting for this increase in funding, because the way the program is set up is basically from 1989 and hasn't changed. And it does not reflect the knowledge that we've gained since then in how to serve people, nor does it fund the level of a professional that you want deployed to your most challenging cases, the sickest folks, because otherwise they're in hospitals and they're in jails at great cost.
Yeah, thanks for sharing that. We've had 2 governors in a row. You mentioned CCS, and Scott Walker was the governor that ended up paying at the state level to make CCS available, comprehensive community services. It's a service that provides services for people with severe persistent mental illness. LSS is, where many counties provided services under that program. So we're very thankful. That wouldn't be available without Scott Walker. And now we have another governor that has been very supportive of mental health. In fact, his budget, he said this is the budget of mental health, and made extraordinary investments. So again, so proud of our current governor for all the investment he has made. Tell us a little bit about some of the things you see in there and how it might be beneficial to Milwaukee County.
So the budget is a bit disappointing because the governor did declare the year of mental health. Many of the amazing ideas that were in that budget have been removed today. We are still hopeful, trying to stay positive that we'll be able to fight for legislation that brings back some of those great ideas, like fully funding CSP, like enhancing county crisis services. But the revenue sharing bill that our county executive and his team have been working on for many years, the city's been working on, that the revenue sharing piece will have an enormous impact on the people I serve, because even though our tax levy is sort of segregated by the mental health board and the rules, our customers need the bus, they use the parks, all the things that would have been threatened before that have been saved by this amazing effort to get some shared revenue back to the county. That improves the quality of life for the people we serve. So it is a very impactful budget in that space. And again, our folks often don't have cars and they rely on public transportation. The parks are their only social outlet that doesn't cost anything. We live in this ecosystem that is obviously impacted by those public services that would not have been funded without the budget intervention.
Yeah. That's great, Mike. Thank you so much for all the wisdom you've imparted with us today. And I have one more question for you. How are you using your punching power to advocate for our sector? And I mean the nonprofit sector as well as the government sector.
Well, I've absolutely invested my punching power in making the case for the funding of CSP and the expansion of service, but really also this notion of approaching this care as a collaborative, that there is no private sector, there is no public sector. There's only a health community that is trying to solve a challenge in that we have many people in our society impacted by mental health and substance use. As you have mentioned, something like a quarter of the population at any given time. Only if we collaborate together will we reduce that impact. We'll make our community healthier. The county's audacious vision is that we're the healthiest community in the state. It's not going to be done by county. It's going to have to be all of us together achieving that goal. And I think we're on the right track. I think that the bones are there. Yeah. And every day I have a great team that is always tirelessly trying to make the services better. They're meeting people in the community where they're at. And truly, we are there as well in our crisis service to support those programs throughout the community to make sure that when something gets to that level, we're there to help. And that collaboration has to start to expand in order to be successful. We need our partners to survive and to make the work happen, but we also need to support our partners with our services that only the county can provide. And that's the relationship we're moving forward with.
Well, thank you so much, Mike. I've always thought you're so smart. I got a little bit smarter being connected to you. You have a huge heart, and you want to do the right thing. And you also are a good leader, and you know how to get stuff done. So thank you for being on my show. Thank you for your friendship. Thank you for your service to the community and all you do. I know so many people love you and are thankful to your leadership. Thank you.
Yeah, well, thanks for the opportunity. And I guess I would just say, or ask you, so 7 years later, so did we do it? Did we do what you expected us to do? And
absolutely. Okay. You guys, got the closure of the inpatient unit and the fact that you got the hospital systems together to collaborate and serve the population. And I really love the fact that how, these aren't county employees, these are people. And you're moving in that direction to try to reduce stigma. Don't give up, champ. There's still more work to be done.
No, there's work to do.
Got to increase those rates. So, thank you.
Thank you.
All right. That was a great episode with Mike. Again, a dear friend, a great leader in this community. He's very smart. He's a great leader. He knows how to bring people along to get some really good stuff done. I'm honored to call him my friend. So just want to debrief and share a few of the key points. In Milwaukee County, HSRI had that report in 2010, and major transformation occurred during that period. And really moving towards a community-based system of care. Mike said we're trying to serve these individuals sooner, more prevention versus costly services. The use of peers and support specialists individuals with lived experience working in this space and support people along their journey of recovery. And so those are things that are very important. Moving upstream, trying to get more into prevention versus institutional care or inpatient care. They have a crisis line, which is a 24/7, 365-day operation available to the community every single day at all times of the day. One thing that's really impressive is the emergency room that was developed by Milwaukee County in partnership with the health systems here in Milwaukee County. What's so impressive about this is that it's not the county patients versus other patients. These are just individuals that need care and are served through this really good partnership. So Mike Lappin and all the health systems and everybody else who was involved in getting that done should be recognized, because I know that this was no easy task, and it's resulting in some great outcomes for the people in Milwaukee County. I gave Mike a little bit of a hard time with those rates. It's hard for nonprofit providers to provide really good quality services when we aren't paid adequate to the difference we make in the lives of the people we serve and the broader community. And I know Mike is making strides. He's trying really hard. They have very limited resources there, but I know it continues to be a thing of concern for him. And I hope that in the future there'll be more robust funding for community-based providers such as LSS and many others that are part of the Milwaukee County behavioral health system. And he's going to use this punching power to continue to make the statement that we are people. We're not county people and other people, but we're just people. And he's going to continue to advocate for that. He's going to continue to advocate for funding. In the budget, there's funding for a community support program for people with mental illness, and he's advocating for a match there. And that would be a game changer for our sector and for even individual organizations like LSS, where we can provide this service in Milwaukee County because there would be more robust funding. That concludes our episode. In the ring with me next is Mike Vickerson, the CEO of M3 Insurance and the sponsor for our podcast. The interview I had with him before was great. And he imparted a lot of great wisdom and insights into the community, and our sector, I'm sure, was very grateful to him. So I'm looking forward to having him again on our show. You can find out more about In the Ring with Hector Colon podcast, our guests, our episodes on our website at lsswis.org/inthering. Like, follow, and share on Facebook, LinkedIn, and Twitter, and subscribe to our YouTube channel so you don't miss any of these important conversations in the future. All right. Thank you, Mike. And again, thanks to our sponsor, M3. Con mucho cariño, with much affection. Bye.